before we get specifically into the tools, there are a few things we need to discuss so that we are all on the same page with how do we decide what tests we should be using and what is a good test. So the first place that I think we should all go to is the Guide for Physical Therapist Practice 3.0. It's a newer guide. It was released in 2014. It's an electronic guide, and in that guide there's a chapter on measurements and outcomes. And the definition that I would like to go over is clinical utility, and really that's the key piece for us to pick our tests. We want to pick objective measures that have a clinical utility. We don't want to just take a test and do a measure for the sake of doing a measure. We want to make sure that we use the data appropriately so that the test can help us decide what we're doing for our patients. And the definition of clinical utility is we consider the precision of the data yielded by a test or measure and whether it will meet the needs of the situation. So very quickly, there are patients that I see that have a diagnosis of heart failure, and that patient may have balance. When I screen them, they appear to have, their gait is within normal limits. Their balance does not seem to be that there's an impairment. So do I need to select 5 balance assessment measures for that patient when it doesn't appear at first glance that balance is an issue? I would say no, that those tests would not have clinical utility to give me information that's necessary and useful for that patient or for the situation that brings them to my office.